Okay, and what's this machine again?
This is the ultrasound. Basically what I've done is I've moved his clothing out of the way and I placed a towel below the area I'm going to treat so that the conductor gel doesn't get all over him, all over me. We're going to do a little ultrasound on the elbow.
And what are those buttons?
This creates a burst sensation,
Okay.
kind of like this. This one is just a straight signal where it just hums constantly. Okay. And these are other different types of bursts.
Okay.
The most common one that I use is this one, and I usually start a patient out about 0.8. It's about medium level.
Okay.
And we only do for 10 minutes unless specified by the doctor. The doctor will tell you what settings to start at and progress to.
Okay.
So that's all you have to do.
Okay.
Press the start button and wiggle this around in your conductor gel in small circular patterns over the infected area. And again, check the chart. The doctor will write on there where you are to treat.
Okay.
And whenever I do this, a lot of times I can feel knots in the patients. That's my job, to go along and feel as well and work on those as time progresses.
Okay.
You like that?
You like that, Kim?
The most common areas I treat are elbows, hands, ankles, feet,
I can't feel anything
shoulders.
besides you just rubbing that on there.
Mm-hmm. That's because it's not very strong.
Okay.
I've done some neck, some lower back, some shoulder blades, done some knees. So it's good. It feels
Okay.
good. Okay.
So mostly the joints.
Mm-hmm.
Okay.
Okay, and I'm going to stop this one. I'm going to wipe off our patient first. They don't like the feel of that, most of them. And they're all ready to get out of this chair. And then we just need to dispose of the towel. These are mine. You don't mind yours being with me. This is the E-stem machine, interferential muscle stem, electronic muscle stem, however your doctor phrases it. It's all the same thing. These are electrodes. This is an alcohol swab to prepare the skin. So I need you to lean forward for me. On regular stem, low back is the most common for this. You just rip open the alcohol gizmo here. Raise up the patient's shirt to reveal where you need to go. You just prepare like you would for an injection site or whatever. You just rub the alcohol on. Let it dry while you hook up the leads to the pads. There's two different colors. There's red and black. And the reason they are done this way is for regular muscle stem. They are crisscrossed to concentrate and regulate the current. I always start with black. It makes no difference what you start with, but you want to feel where the spine is. And you can also feel around and feel for the intensity of the muscles and tissue surrounding. You want to find a good spot that's not directly on a bone. Sorry. That's a tender spot for him, so we're going to put that there. And it's not on the bone. It's next to the bone, but not on the bone. I'm going to take the other black one because I put this black one on the bottom. I'm going to feel his spine. I'm going to go over about a finger width and place the other black one so it's catty-cornered. And then I have the red leads to place. Again, feel the spine. I'm going to go just about 2 finger widths above my black one. That gives me a good close area to concentrate the signals. and then the other red one is placed below the other black one. Then you can pull their shirt back down for them, and they can lean back and relax. And most of the muscle stim treatments we do are for 15 minutes. And of course, it resets itself as soon as I push the right side. You hit the start button, and then you slowly, very slowly, go up until the patient tells you that they can feel the current. He can feel the current.
Yeah, I can
Sudden
feel
jump.
it.
And then you say, okay, now you can feel it. Now tell me when it gets uncomfortable. Or as strong as,
That's about good.
okay. And then you're just going to press the vector button. And the intensity will kind of circulate through the muscles. This is really good for people that don't hold adjustments well, because once the adjustment is done, the spine is mostly in line, and you got to strengthen those muscles to adhere to the spine to make the adjustment last. Okay, that's regular stem. If you want to see Russian, lean forward again for me. A Russian stem is done with only one color and is done on the same side. So we're going to take these red ones off. A Russian stem is basically done to really intensify something. So he was really tender on this side. So we're going to place them, again, about a finger width apart, but just on top of each other. And again, it's only the black side. Okay, lay back for me. And I'll try not to make you jump out of the chair. Russian is done for 10 minutes unless the doctor specifies other, and it's done at 250 megahertz instead of 150 because it's, again, stronger. And Russian is either in 10 cycles or 10-50 cycles, which means 10 seconds on, 10 seconds off, 10 seconds on, 50 seconds off. Doctor, again, will specify. So since we're only using the black leads this time, I only need to go on one side. Here we go, okay. Slow.
Okay, that's good.
Okay, he can feel it. And normally my patients, whenever they tell me that, I usually go up 2 more notches and then I hit their cycle button. So it'll cycle off for 10 seconds and then it'll come back on 10 seconds later. So it's kind of a pulse, intense pulse. See, there it goes up.
Okay.
Okay?
I need one of these at home.
Yes, you do.
That's pretty neat.
Okay, I'm going to stop this. You can go ahead and lean up and I'll take these off of you. Taking them off is just like putting them on. You just pull them off, stick them back on the plastic. Most offices reuse these, 1 per patient. In other words, if Ken is my patient, he's going to have a bag in here with his name on it. These just happen to have my name. So we're Skin Brothers.
I'm far up.